Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So how do we diagnose and stage mesothelioma? It's a little bit different than some other cancers in that you really do need a pretty large biopsy in order to make this diagnosis. So it usually requires a VATS surgical biopsy for diagnosis. So that's a video-assisted thoracotomy. And that's shown here with a minimally invasive approach of just 3 small incisions to get in, as opposed to opening up the whole chest to take a look at the lining of the lung. The peritoneum is often confused for gynecologic cancer, such as ovarian cancer, so it's often found during a surgery intended for that type of cancer. There are 3 types of mesothelioma, and these are basically the appearance that you see under the microscope. Epithelioid is the most common, accounting for about 70%. And then sarcomatoid is the least common, just has a different appearance under the microscope. And biphasic is a mix between the two. Staging is not actually that important in mesothelioma. What's most important is whether the disease can be resected surgically or not. And that is essentially an opinion by the surgeon that's performing the procedure. There are certainly guidelines as to what is resectable and what's not, but the staging system doesn't help us that much clinically. This was a figure from an article in the New England Journal of Medicine recently talking about the updates in mesothelioma, and the fact that there was a New England Journal article about mesothelioma should hint that maybe there have been some really great updates, which I hope we'll cover in just a little bit. But I think this is also a nice figure showing the inhaled asbestos fibers that go to the lining of the lung. Over time, those don't always, but they can develop into a mesothelioma tumor. And then here it has a nice picture of the 3 different subtypes, epithelioid having a kind of more organized appearance, sarcomatoid having a more disorganized appearance, and biphasic having somewhere in between. And then the current and future treatments we're going to focus on just in a little bit.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.